That's a very good question because we do run into it, believe me. Um, if they are married, if they have children, I approach it as a family event. That is, this is not just your event. Okay, your father, your husband, your brother, your uncle, your nephew, you're part of a family unit. So you want to protect that family unit moving forward. And it is critically important that you understand it's not just the individual man, but it's also the associated family members. And also let them know, because sometimes we get men in their 70s who are somewhat familiar with the Tuskegee experiment back in the 40s, and that has imprinted them with some suspicion of the medical field. But what I've seen is that once I talked to them and said, you could be my brother or I could be sitting in your chair, and we can cure this, because men want to know a couple of things when they're diagnosed with prostate cancer. They want to know, I want the best possible outcome, but I also want to maintain a good quality of life. The fear is of the unknown. And you want to be here to see the grandchildren and the daughter walking down the aisle. So I really approach it from a family perspective. Occasionally we get single men. But do you want to have children? Well, yes. Well, let's get you on the road to having children, because this cancer, by definition, can shorten your lifespan if you don't address it in the correct way. And if they're in my office, I walk them through the entire process. They may even want to speak with men who have been in that position, who have now been treated, and now they're 5, 10, 15 years out. There's nothing like having a peer talk to you who have gone through it. I think patients get a different perspective and they buy into it, as opposed to a physician saying you need to do X, Y, and Z. And most of the time, because we all go through those 4 or 5 stages when we get bad news, right? We just have to work them through it. There's no way to rush through it, but you give them their space. Because I see men come in and they say, well, doc, I'm ready to go. Let's attack this. Then I see men come and you can see the fear in their eyes, because there's a certain connotation that comes with that 6-letter, 2-syllable word. And I try to parse that. Not all cancers are the same. And so it's really entail of just sitting down, trying to connect with them, let them know that this is quite curable. Treatment is dictated by, like, prostate cancers are like human beings. You can have different levels of aggressiveness, right? Some cancers are very indolent. They're very non-aggressive. They are defined as cancer. One, you don't have to rush to make the decision. You have time. But now some cancers are very aggressive and you need to move with more than deliberate speed. It really depends on the individual case, but ultimately there are a number of categories of treatments. On one end of the spectrum, you have surgery. Now, I'm not a surgeon. The urologists, they go in, they remove the prostate. 80 to 85% of the surgeries are now done robotically. Okay, what they call robotic assisted radical prostatectomy. So it's not your grandfather's surgery. A much more sophisticated way of doing surgery. The downtime is much less. They get out of the hospital maybe 4 to 5 days even earlier than what they used to. So that's one end of the spectrum, surgery. The other end, there's something called active surveillance. For example, some prostate cancers are so indolent, so non-aggressive, that men will succumb to their cardiovascular disease or their pulmonary disease and not their cancer. Radiation. Radiation is a well-proven, long history treatment. We've been doing that since the early 70s. Patients usually have a very good outcome. There's different types of radiation. There's something called cryotherapy, where you can freeze the cancer cells within the prostate. Now, that's not a standard approach, but if you Google treatment for prostate cancer, you probably get about 12 different treatment options. And there's the FDA, the Food and Drug Administration, approved the technology maybe 7-8 years ago. I'm going to give you the acronym. It's called HIFU, H-I-F-U, High Intensity Focused Ultrasound, where they heat the cells to death. Now, that treatment has been approved, but we don't have long-term results of it. Then there's hormonal therapy, there's chemotherapy, there's targeted therapy, there's immunotherapy. There's a whole category. A lot of it really depends on three things really. The aggressiveness of the cancer, the stage of the cancer, whether it's localized or it has metastasized, the age/health of the patient. So those are the three main drivers in terms of what would be the optimal treatment for any one individual man. But if it's localized, then you just get local treatment. Surgery takes about 3 to 4 hours. It's a one-day procedure. We can do radiation, what we call brachytherapy or seed implants. That takes 20 to 30 minutes. So it is a process, and it's new to men. Remember, some of these men may have not gone to physicians in years. So you have to step back to see where they're located and try to connect with them to bring them along.